we are back at Capizzi MD with Dr. Peter Capizzi today. I know we've been answering a lot of questions from you guys and covering some pretty hot topics lately, but we want to take a minute today and just talk about the clinic itself, why Capizzi MD, highlight on Dr. Capizzi's experience, and then some of the value propositions and add-ons that we offer here at Capizzi MD, and why you might want to choose this as your breast augmentation surgery option. So we'll start off. Just tell us a little bit about your experience, if you don't mind.
Well, hey, I don't mind. Hi, good morning. Well, I do have a little experience. I was trained at the Mayo Clinic, and when I arrived here, I started my own practice. I was the first one with a fellowship in specifically cosmetic breast surgery, and brought the gummy bear or the highly cohesive gel to Charlotte and North Carolina. I was one of the co-investigators for the FDA at that time, and continued on since 2008. We were using them. They became approved in 2013, and I've been on the other fourth generation studies for basically all of the three implant companies, Mentor, Allergan, and Sientra studies. So we have a lot of experience with that. We've also put in saline implants, and we also offer basically exposure to any implant or most implants that are on the market. So even the ones that are in the pamphlet, there are ones that are off the pamphlet that are approved that if we need to get them based on our patients' findings or clinical wishes, we're able to usually get them. I think the other thing is that 20 years ago, we were concerned about the procedure and how to get the procedure better, strong, smoother, more efficient, better recovery, and now it's all about the patient experience. And so we have people that come from, this past year, we placed over 350 implants. We had them from people from at least 15 states, and I've definitely taken care of people from around the U.S. and from across the water.
Yeah.
So
see, that's a really good point that you said you did 350 last year. So it is still very popular and a very positive, experience for a lot of people. It's not, exactly what you might be seeing out there. I had a great experience with mine, and I feel like a brand new person. Lots of other people feel the same way. So it is still a very, very popular, surgery choice and cosmetic choice for a lot of women today. I know it says you've probably put in about 10,000 different implants, or like how many do you think you've put in?
It's probably upward. It's probably getting there.
Wow, that's crazy.
It's a lot of them.
So tell me about, you said there's a lot of models available to us that you said pretty much anything a patient wants you can get. Tell me about that. Like you can get some that aren't on the spec sheets.
Yeah, the ones that are not on the spec sheets. So the FDA approves similar implants that are extended on the spec sheet, and at times the print is usually older than the actual approval. So it takes a little time, and we'll get into that, but because we have a close relationship with some of the implant manufacturers, we're able to get these implants. They all have the same warranty. They have a lifetime warranty for deflation and 20-year for contracture. It's just part of being on the envelope or on the threshold of things that are new, that are available to our patients, and we want to expose them to it and say, hey, these are your options. We're not trying to limit you just to like a saline implant. Or something like that.
Yeah, that's a good segue. That's one of the questions that I was going to ask you. Saline implants do seem like an appealing option for a handful of reasons. A lot of people still get them today. It might be because of cost. Is it because of that? Let's just talk pros and cons real quickly before we go into some of the clinical experiences and different education things you guys do about the pros and cons of saline versus gel. Kind of why would you want to get one or the other?
So why one would want to get a saline implant? First of all, if I see a woman and she wants a saline implant, I put a saline implant in. It's their choice. But I'll expose them to the options, and I really am more someone that wants to look at the outcomes. Most people would feel the outcomes for a gel implant, whether it be a fourth or fifth generation gel, will be better. They'll be softer. They'll be more lifelike. On the other side, people will say, saline, it doesn't expose you to silicone, which is not necessarily the case. You have a silicone envelope, which is kind of like the plastic bag that holds the saline fluid in. If you have a deflation with saline, which is more common in saline, then you obviously know it because your body absorbs the water. Gel implants, you might have something called a silent rupture. Although the highly cohesive gel, it's less than 1%, and I've seen 1 out of 4,500, and or thereabouts. So I think that saline implants, they're available. There's certainly a lot on social media, but I also tell my patients, hey, try to go to a reputable site like the American Board of Plastic Surgery, the American Plastic Surgery Society, ASPS, or ASAPS, the Aesthetic Society of American Plastic Surgery, or the FDA, and get your information there, because then you know you're getting it from the horse's mouth.
Right. And we are on social media talking about this, but like he says, check your work, do some research yourself, and kind of back up what some of these people on Instagram are saying. So is it true that saline might be a little bit cheaper for like a business to buy?
Oh yeah, saline implants usually represent about 25% of the cost of a gummy bear implant, for instance.
Yeah.
So they're definitely less expensive.
No, that's a good point. So just keep that in mind when you're doing your homework and just deciding kind of what's best for you. As far as like science at Capizzi MD itself and what you are involved in, so clinical research involving learning, education, ongoing stuff like that. You want to talk to us about that?
Yeah, well, we have. I'm involved with multiple studies that are ongoing. One is it's actually now this study is closed, but it was with the 410 device. I'm also in the middle of writing a paper regarding our gummy bear experience. We've papers with Profound, which is not breast implants, but it's Profound RF, and Kybella, which is an Allergan product. We also have comprehensive care for all our patients. So we are interested in the procedure, but we're interested more in the patient as a whole. So we have a lot more than just the procedure itself here. So we take care of you, and that's something we developed with the Capizzi method, so to speak, using lymphatic treatment afterwards, post-operatively. That's all part of the treatment if you're having surgery.
Yeah, we are going to do another topic about enhanced recovery and why getting this surgical option is a little bit better today than it used to be in the past, and what are some great new tactics and developments that they've made in researching ways to improve recovery overall. So it's not as invasive as it used to be. But kind of segueing into what you were just saying about patient satisfaction, tell us about your patient satisfaction ratings here.
Well, patient satisfaction for breast augmentation is about 98%. It's
awesome.
Yeah, and usually, that's the most common procedure that I do, and the most common procedure that's done here. And the last 2 years, it's the most common procedure in plastic surgery. Certainly, people say, hey, more people are taking their implants, maybe removing them, but I'll have to tell you that we're up last year about 12% with regards to placing them in. So I think there are so many good benefits about filling out your clothes, feeling better about yourself. Actually, most people are like yourself. You're an exercise person. You like to be working out. You're concerned about your body, and we love that. And I encourage that highly. So I want to get people back to feeling good about themselves. And there are risks with any procedure, but we have so many excellent attributes to breast augmentation. I think they're hard to overlook.
Right, so like he's saying, it's still a great option for lots of women like myself, plenty of others. It still can be a very easy experience and positive as well. So for the last thing I just want to talk about real quick is what's developed over the last 10 years that makes this procedure the most sought after procedure in the practice.
There's several. I think the first thing is that we're all talking about breast implants. Breast implants have gotten that industry. We have the 5th generation on the market for the last now 7 years. And you have them in shaped or round form. You have in high profile, moderate profile. You also have a gel, what's called a gel to shell ratio or relationship that is much more fill in a specific space, and that gives a much more, let's say, sensual or appealing shape to a woman's breast. So you can match or at least achieve symmetry in a lot more women these days, so in that regard. The other is anesthesia. Anesthesia's, we're always looking at trying to improve anesthesia, especially on the heels of opioids. I haven't been using opioids as a first-line pain medication for honestly over 15 years. For a number of reasons. We use ibuprofen, Tylenol, and Tramadol, but we also use local anesthetic. And so we're going to begin using more local anesthetic and maybe some more local regional blocks to help our patients get back to work the next day, which is hard to believe because when I first started 25 years ago,
It's a major deal.
yeah, people were all wrapped up like a mummy, and you couldn't do anything, couldn't raise your arms, and we're not that way. And I think finally, the newest thing, and we can talk about this on another time, would be ultrasound. Or my patients will have the benefit of, I have an ultrasound now. If you had a breast augmentation with me and you're concerned, hey, I'm concerned about this implant, I can examine you. Not only that, I can ultrasound you and give you that information. And we have had it now for the last month and using it daily. So it's been very well received.
That's awesome. So there's so many things. There's so many things we could talk about, and it's kind of like every time we talk, we end up talking and going through one of these little segments. We end up thinking of something else that you guys would love to hear, or one of you guys asked me something. So keep it coming. Thank you so much for telling us about the clinic itself, because I know we've been interviewing this doctor, and we want to see
Who is
more.
this guy?
Who is this person? Yeah. So it's we got a lot of credentials we wanted to cover, and so the next topic we are going to talk about is going to be enhanced recovery, kind of ways that insertion has changed, all different types of things like that, and like he was saying, the local anesthetic too. But stay tuned. Thank you.
Thanks.